A healthy diet for gout patients focuses on reducing uric acid levels and minimizing the frequency and severity of gout attacks. Here are key dietary recommendations. And Hashner. 1. Limit purine-rich foods. Avoid high purine foods such as organ meats, liver, kidney, red meat, shellfish, shrimp, lobster, and certain fish, anchovies, sardines, mackerel. Limit consumption of high purine vegetables like asparagus, spinach, and mushrooms, although these generally have a lesser effect than animal-based purines. Number 2. Increase low purine foods. Eat plenty of fruits, especially cherries, which have been shown to reduce the risk of gout attacks. Focus on vegetables, whole grains, and low-fat dairy products. Choose lean proteins like poultry and tofu. Number 3. Stay hydrated. Drink plenty of water throughout the day, at least 8 glasses, to help flush uric acid out of the body. Limit or avoid sugary drinks and alcohol, particularly beer, which can increase uric acid levels. 4. Reduce sugar and fructose intake. Avoid foods and drinks high in fructose, such as sugary beverages and sweets, which can trigger gout attacks. 5. Choose low-fat dairy. Low-fat dairy products like skim milk and yogurt may help reduce the risk of gout attacks. These are considered safe and beneficial for gout patients. 6. Avoid alcohol, especially beer. Beer is high in purines and can significantly raise uric acid levels. Wine is a better option in moderation, but it's still best to limit alcohol intake overall. 7. Maintain a healthy weight. Obesity is a risk factor for gout, so maintaining a healthy weight through balanced eating and regular physical activity can help reduce the frequency of gout attacks. Sample gout-friendly foods. Fruits. Cherries, citrus fruits, strawberries, apples, vegetables, leafy greens, bell peppers, broccoli, and other low-purine vegetables. Grains, brown rice, whole wheat bread, and oats. Proteins, skinless poultry, eggs, and plant-based proteins like lentils and beans in moderation. Dairy, low-fat or fat-free milk, yogurt, and cheese. Following these guidelines can help manage gout and reduce the risk of flare-ups. However, it's always best to work with a healthcare provider to create a personalized diet plan. Tea and coffee can be part of a gout-friendly diet, but they should be consumed with some considerations. Coffee, potential benefits. Research suggests that moderate coffee consumption may be beneficial for gout patients. Studies indicate that coffee might lower uric acid levels and reduce the risk of gout attacks, possibly due to its ability to improve insulin sensitivity and promote uric acid excretion. Recommended intake: moderate coffee consumption, about 1 to 3 cups per day, is generally considered safe for most people with gout. However, drinking too much coffee may lead to dehydration, which can trigger gout attacks, so it's important to balance coffee intake with plenty of water. Tea. Green tea. Green tea contains antioxidants and has been shown to have anti-inflammatory properties, which may help reduce gout-related inflammation. There is some evidence that green tea could help lower uric acid levels, but more research is needed to confirm this. Black tea. While black tea contains purines, the amount is relatively low compared to high purine foods. Moderate consumption of black tea, 1 to 2 cups per day, is usually safe for gout patients, though staying hydrated is key. General recommendations. Hydration. Both coffee and tea can have diuretic effects, which may increase urination and potentially lead to dehydration if consumed in excess. Dehydration can trigger gout attacks, so it's essential for gout patients to stay well hydrated when consuming these beverages. Moderation. Drinking tea and coffee in moderation is generally fine for gout patients, but it should be part of an overall balanced diet that includes adequate water intake. Always consult with a healthcare provider to determine the best dietary choices based on individual health conditions. When considering gout management, the choice between red meat and fish should be approached carefully due to their purine content, which directly impacts uric acid levels and the likelihood of gout flare-ups. Here's a detailed comparison. Hashtag 1. Red meat. Purine content, especially from animals like beef, lamb, and pork, contains moderate to high levels of purines. These purines can break down into uric acid, increasing the risk of gout attacks. Health risks. Regular consumption of red meat is associated with increased risks of cardiovascular disease and certain cancers. In gout patients, the high purine content makes red meat a potential trigger for flare-ups. Recommendations: gout patients are advised to limit their intake of red meat. If consumed, it should be in moderation, with lean cuts being preferable, e.g., sirloin or tenderloin, and portions kept small. Fish, purine content. The purine content in fish varies significantly depending on the type. Certain fish, such as anchovies, sardines, mackerel, and herring, are very high in purines and can trigger gout attacks. Other fish, like salmon and tuna, have moderate purine levels. Health benefits. Fish, particularly fatty fish like salmon, are rich in omega-3 fatty acids, which have anti-inflammatory properties and can be beneficial for overall heart health. These anti-inflammatory effects could theoretically help with gout-related inflammation. Recommendations. While fish provides essential nutrients, gout patients should choose their fish wisely. Low to moderate purine fish like salmon are generally safer options and can be consumed in moderation. High purine fish like sardines and mackerel should be avoided or eaten sparingly. Conclusion: better option if comparing red meat and fish for a gout-friendly diet. Fish is generally the better option, especially if you choose low to moderate purine varieties like salmon or cod. These types of fish provide important nutrients, such as omega-3 fatty acids, without the high purine content that can trigger gout attacks. Caution. However, it's essential to avoid high purine fish like mackerel, anchovies, and sardines, which can be just as problematic for gout as red meat. Balance and moderation. Both red meat and fish should be consumed in moderation. Gout patients should prioritize plant-based protein sources and lean proteins like poultry, while limiting both red meat and high purine fish to reduce the risk of flare-ups. A healthcare provider or dietitian can help tailor a diet that balances these options while managing gout effectively.